Hello. I am Aslin Wang, now Dr. Wang, and I'm really happy that I'm just about to graduate. Very excited about that. I'm very excited about being with you all this evening. I've been studying to become a doctor for a long time now, and also in the deaf community for a long time. And I've looked forward to this time that I could finally have this workshop and see how those two worlds combine. In this presentation, we're recording it for myself, actually. When I'm done, we'll stop the recording so that your questions won't be recorded. Also, if you have any questions, please make note of them. And then after I've done my presentation and we have the question and answer period, you can pose those questions. If you have a personal medical question, uh, hang on to that. This isn't really the place to ask that. The answer could be quite complex, and we could always meet, come to my practice, and I can explain whatever it is that you have a question about in more depth. But this evening it's for general questions, questions that asking in public, that type of question. So now I'll start the formal part of my presentation. This is the family clinic. And my first question is, do you have a family doctor? And there's my name. You can see Aslin Wang. It's funny to see a picture of myself, and now I'm in my picture. Who are we? So I graduated from family medicine. I have just 2 weeks left in my residency. So by the end of June, I will be a full-fledged medical doctor, able to practice this fall. Some of you already know me because I have been in the deaf community for several years. I'm involved with Seeing Voices Montreal, and just from events in the deaf community, I have met many of you, and that's why another reason I'm really excited to see so many this evening in this workshop. As you can see, I can use ASL, and I hope I'm clear enough. We have Patty being here as well, just as a double check to make sure that everything is so clear. Because I am interested in working with you all. And as well, so I know ASL, I know English and French and Mandarin, and I hope soon to be learning LSQ as well. I know, I'm busy, but at one point I will also add LSQ to that. I want to explain a little bit about what is family medicine. You might be asking yourself that. What does it entail? Some of you might even have a family doctor, some of you not. Some of you may have never been to a doctor. Well, family medicine is where the doctors are generalists as opposed to specialists. We take care of people of different ages, from infancy through childhood, teenagers, adults, into an elderly age, men and women. Family doctors can address children, that is, looked after the needs of children. You don't necessarily have to go to a specialist, a pediatric specialist. If it's a general health problem, if there's a specific health problem, then as a family doctor, I can refer you to a specialist. But in family medicine, we address medical problems across a broad spectrum. We become the center of your medical care. because there are many different specialists out there, cardiac, mental health, respiratory, the lungs, different things. And so as a family medicine doctor, I'm there to act between you and these other specialists to steer you towards the right specialist, to make sure you can understand what your health needs are at the moment and how they can be addressed either by myself or another practitioner who is a specialist. And then lastly, depending on the family doctor's practice, they can handle a range of things. Some are more generalists, some specialize a little bit, like limit the range of services that they offer. We can look after women's health, for example, during pregnancy. Some deliver the baby, some not. Some help manage acute or chronic illness, depending on sudden onset or if something is ongoing. And we also perform various procedures, maybe look after problems with your skin, minor injuries, as well as women's health in general, gynecological and other health needs that are specific to women. I'll just ask for my next slide. So the age groups I mentioned, in general family medicine. Let me now focus on my own practice. I'm able to take care of all these age ranges here: infants, children and teens, adults, the elderly, and pregnant women, although I don't actually do the delivery. You would have to go to a hospital and a natal unit for that. But the prenatal care, I can look after that. And more specifically, in terms of all these various ages and what might be the conditions that they have, as I mentioned, women's health, including contraception. And when I refer to contraception, I'm talking about preventing pregnancy by various means. It could be the pill, it could be an IUD. Those are contraceptions. Mental health is another area. Well, child visits. A child sees the doctor once or twice a year, or if they're not well, they can come in. And common infections. It could be a cough. It could be a penile infection. Vaccinations. I'll be able to give those for a variety of reasons. And I do many more things as well. Oh, well, for example, we can work on procedures having to do with your skin. Maybe you have a lesion, you have something on your skin that needs to be removed. I could do that. Perhaps you're wanting an IUD as part of the women's health I was talking about and contraceptions. I can fit you with an IUD. Maybe you might have a joint that's painful, could be the shoulder, the knees, and you need periodic injections to relieve the pain. You might have a cut. You could have had an accident and you need stitches. I can take care of that. So those are just some of the things that pop up, in health that I can include in my practice. So now I'd like to talk about, okay, then who is eligible to receive these services from family medicine and the deaf clinic in particular, because I'm going to be specializing in creating this deaf clinic of family medicine. So first of all, you have to live in Quebec and have a valid RAMQ card, the health card. There you go, is the slightly older one. If you don't have a RAMQ card, you're not registered with RAMQ, I can't put you into the public health system. If, for example, someone's from Ontario and they don't have a card, again, I can't see that patient. If you're deaf or hard of hearing, an adult or child, you could be a signer or an oral deaf person, a speech reader. You can choose which language you would like to work in, excuse me. Or you might yourself be a deaf person who's a parent, a mother or father, and you have children who themselves are not deaf. You can still come see me because I want to communicate with you as the child's parent. So if you are a deaf parent of a hearing child, I can take you into my practice. And the other way around, you might be parents who can hear and your child is the one who is deaf. Then that way I can simply speak to you as the parents and look after the child in whichever way, orally or signing with them. And if you've come to Canada as an immigrant or a refugee, again, and you've been registered with the RAMQ system, be it, your background is that as an immigrant or refugee, as long as you're in the system and a deaf person, I can see you in my clinical practice. Now, the clinic itself is located in the Queen Elizabeth Health Complex. It's very close to the old Mackay School. The metro would be Vendôme, easy to access. Then you walk from the Vendôme metro, right there. I feel, like a weatherman, is trying to, the cold front coming in from the north. But anyway, from Vendôme metro, it's a very quick walk, 5 minutes. If you don't have a car, because parking actually in that area, NDG, that's where it's located. So parking is a little limited. It's street parking. So if you can take the metro, that would be good. The deaf clinic will be held once a week on Fridays, all day on Fridays. I'll see deaf patients. For now, it's on Fridays. Maybe I'll be able to expand it. And maybe I can even have it set up in a different location as well. But for now, at the Queen Elizabeth Health Complex, it's Fridays, all day Friday. You can book an appointment. And the Queen Elizabeth Health Complex is associated or affiliated with the McGill Medical Center, medical clinic. So I just call it the Queenie for short. Here's the address. And in fact, the Queen Elizabeth Hospital has 2 entrances because it's a block wide. If you look on the map, it's Northcliffe. This is really hard to, I don't know how weathermen do it. This is hard. Okay, so there we go. So Northcliffe, between Northcliffe So there, in fact, there are 2 doors to come in. One is on Northcliffe and the other is on Marlow. Marlow the door right now is actually closed because of COVID. It's the white, it's more the older stone front. So don't use the Marlow address. Simply walk the 1 street over and come up Northcliffe. It's the brown brick side of the building. If you don't remember and you have to walk around the block, you're going to be late for your appointment at my clinic. So make sure that you only come in the Northcliffe doors until you hear otherwise. If you had to call, which you can through video relay service, the VRS phone interpreting service, you can. So there's the phone number. Now, how would you register for the clinic? And in particular to see me as the doctor. And as I said, I'm graduating in June. I'm going to take a little break in July. And so the clinic will officially open the second week in August. It is important that you email this address, the MUHC, .familymed. Email what your issue is. Say that the subject line, you have to say Deaf Clinic with Dr. Weng. And then give all this information, your name, your phone number, VRS phone number, because to make the call, it would be through VRS. That's very important. So therefore, it's important that you actually have a VRS account and you know how to check your VRS messages. Because if you're called back through the interpreting service, the VRS service, and you miss the message from the clinic, then you're going to miss your appointment. We'll need to know your email address, your date of birth, and your valid RAMQ number. So put all of that in the email, because then we'll know how to contact you and make an appointment with me in the clinic. Now, this last part is important. You may have a family doctor already, and you might be considering coming over, transferring over to my practice. It's important that you first meet your current family doctor and tell them that you have found another family doctor who can sign. It's a deaf clinic. And so, current family doctor, would you please deregister me, remove me from your practice so that I can register with Dr. Weng? Because if you don't deregister and try to come to my clinic, it won't work. So you need to be unregistered, deregistered with any other doctor. I want to explain a little bit, what is a GMF? You might have seen that acronym, GMF. There's the full name. It's a French term, Groupe de Médecins de Famille. It means that it's a physical location, a clinic, where there are family doctors who accept appointments. And then there's also a walk-in clinic where there are healthcare professionals there in the center for you to look after you. The Queen Elizabeth is a GMF. And in the building, there are in fact the two parts. One is the family medicine clinics. And then the other section is the walk-in clinics. You might be curious what the difference is between the two. So in the family medicine clinic, you actually have an appointment. For example, on the Friday deaf clinics. If you want to come see me in the deaf clinic, you absolutely must have an appointment. If something were to happen to you, like you've got a bad cut or an infection that just won't go away, you need to see somebody, and my Fridays are full, you can instead go to the walk-in clinic where you don't need an appointment. You can see people there are waiting for their appointment. Sometimes there is a bit of a lineup. I mean, with COVID, we prefer that you call first so that you have a more specific time. They'll give you a same day appointment. You can call through VRS. And if they feel they need to see you in person, then they will ask you to also come in person. It's because of COVID. Otherwise, some of the way that we're looking after patients is through telemedicine. So I don't work in the walk-in clinic part. I'm in the family medicine clinic part, where we always have appointments, booked appointments. If you're going to go to the walk-in clinic for access, I would suggest that you arrange to meet an interpreter there as well. I briefly want to touch on the team. There's myself, but there are other healthcare professionals as well. There'll be a secretary, very nice. In the summer, she's going to learn a little ASL, so she'll be able to greet you as the receptionist. We also have nurses who assist me greatly, and so they will also be looking after you. We have a psychologist and a social worker, but with them you would need to have an interpreter. And an important thing to share with you is that the Queen Elizabeth Health Complex, it's also a training center. It's been designated a teaching center, partially because of its affiliation with McGill University. Because of that, many med students and residents will come and work at the clinic to gain experience. So when your first second visit, when you come for the deaf clinic, you would actually first meet a different person who is a medical student, or they might be a medical resident. So for that, there would be interpretation. You would have an interpreter there. Then after that, in the next appointment, or maybe that same day, but I would be the last professional that you see. I'll be teaching them, the med students and the residents, how to work with deaf patients, so that it's a good opportunity for them as well. If you come to the clinic, that they'll gain more experience so that when they graduate and they're out in the field, they'll be able to work with deaf patients as well. And so we really appreciate you doing that, coming to the clinic, being a patient, and also accepting to work with the med students and the medical residents. I want to say a little bit about interpreters. Now, I myself am signing ASL, but if you came to the clinic and had an appointment with me, and we're signing in such a way that communication actually wasn't that effective, it was breaking down. Between us, we're not really understanding each other. It might be that I don't understand your signs or vice versa. Then I can bring in a deaf interpreter. And if I feel that I'm not understanding you, I'm going to suggest that we get a deaf interpreter in. So I hope that you're flexible. Don't be shy. I'm not going to be insulted. If you find that I'm trying to explain something or tell you something and I'm not being clear, then let me know. And I have no problem with bringing in a deaf person as an interpreter, a DI, a deaf interpreter, who will clarify our message between us. Often I may need to refer a patient to another specialist, to another doctor, a specialist, and those specialists won't be able to sign. So in those cases, you would want to get an interpreter. And I always recommend that you ask for an interpreter who's a member of CASLI, a professional interpreting association. It means that they're educated, they're graduated, they have training, and they know the code of ethics and the rules about interpreting. I have actually experienced working with interpreters that are not qualified, and it's honestly, I could see that things were not clear. And I've asked deaf patients in follow-up, when you went to that specialist, did you have an interpreter? Did you understand what's going on? But they say, yeah, well, there was somebody there, but they weren't clear. So always, always, always ensure that you have an interpreter who is affiliated with CASLI, CASLI, the Canadian Association of Sign Language Interpreters. You can prefer an interpreter. You can state that preference. But when you come and see me after seeing a specialist, I will ask you follow-up questions and I'll want to know how it went. So I'm hoping that you ensure the interpretation is clear because you need to be able to follow up with medication, etc. So let me talk about what it's like when you have an appointment at the deaf clinic. Some of you may have experienced going to a doctor already, some not. So I thought I'd take this opportunity to share with you what how the deaf clinic would be running and what are some of the rules. So the first appointment is going to take longer. And like I said, it won't be with me. The first time you're going to have an appointment, there will be more questions. It is going to take longer. I want to know, do you have a health problem or not? How is your general health? If you're not having any problems, then it might be as short as 20 minutes. But if you are experiencing anything, then know that it could be 30 minutes, maybe even 45 minutes for your appointment. So after your first appointment, then we'll have follow-up appointments. Those tend to be a lot shorter, could be 10, 15 minutes. It's important when you come to see the doctor, especially if we haven't seen each other in a long time, you can't really present all the problems that have been happening since we last saw each other. That it doesn't work that way. Honestly, that's too much. Time is short, and so just keep it to two important issues. If there's a third and a fourth thing that needs to be addressed, we'll make another appointment. But don't try and pile everything into one short appointment. It's too much, and time is against you. It's not going to work. And of course, we have to try and keep the time schedule accurate, keep to the schedule because other deaf patients are waiting. And I don't mind if you make another appointment and we can follow up with other issues. That's okay. Now, an important thing is that you are there on time. It doesn't work if you're late because my schedule, the clinic schedule, is going to be very tight. And so if you show up even 10 minutes late, your spot could be gone. Now, it's possible I might be late because I'm seeing a patient that's needed a little more time. Maybe, the appointment is for 10:20 and it's now 10:30. It's not that I don't want to see you. It means that I'm still addressing the issues with the patient that's before you, or a couple of people before you have caused a delay in the schedule. Because I want to look after people properly. But I ask you then, if my schedule, if the clinic schedule is run behind, I'll ask you to be patient. These are some further rules. Now, the appointment can be either in person, on site, where you would come into the medical office, the clinic, or they can be on Zoom. It depends on your situation. And also we have to see what happens with COVID, whether the clinic will be fully open. By the fall, I'm not sure if everybody will be coming to the office. If you don't have a VRS phone number, our secretary won't be able to call you and confirm the appointment to have a teleconference, to have a Zoom appointment. So that's why it's important that you have that VRS number. The clinic won't be texting you. We can send a video email or a video VRS call, but not texting. If you have an appointment and last minute you need to cancel it, we would prefer, if possible, 24 hours notice. But really, if something is out of your control and you just cannot get there to the appointment, please call and let the reception know. Otherwise, we're all waiting for you to come. So it's important that you let us know if you're unable to make it. If you just don't show up, that's a waste of the clinic's time, my time. And I could have been seeing other deaf people in that time. So it's important. You don't want to waste my time as the doctor that I could be addressing other people's issues. And after you miss twice, you'll get a warning, because on the third time, if you've missed an appointment, then you're no longer in the deaf clinic. I mean, that's just a standard rule throughout medicine. So please respect when you have an appointment. Also, don't be late. Don't be late. As we may not be able to see you. I may not be able to see you that same day. And talking about confidentiality, well, as a doctor, I have regulations that I have to adhere to. They're dictated by the Ministry of Health, and confidentiality is a big one. Now, a lot of you know my face, you know me from the deaf community. So if I happen to run into you out there in the deaf community after we've had an appointment, in the past, I out in public, confidentiality is a requirement of a doctor. So at a deaf event in the deaf community, I might run into you and you're actually a patient of mine. What I won't do is walk up and go, "Oh, hi." Instead, our practice is to maintain that confidentiality, because in a way, how do I know you? I'll wait. So that if I see you out in public, I won't say hi first. If you come up to me, then I'll acknowledge that I know you. But it won't be, "Oh, hi," kind of like the last time I saw you was at the clinic, because I have to maintain confidentiality. But I think you might be asking me about that in the Q&A um, portion. So I can talk a bit more about that later. Now, preventative medicine at the deaf clinic, we'll be addressing that, and there'll be some rules that go with that as well. That's one of the aspects of family medicine. So preventative medicine is just that. It's helping you stay well. And you might be thinking to yourself, "I feel okay. I'm generally healthy. Do I really need to see a doctor?" Well, I can answer that one for you. Children, because it depends on your age. But let's say for children, they seem healthy, haven't had any illnesses. If the child is more than 2, like 3 or 4 years old, they can still see a family doctor once a year, maybe once every couple of years, just for a checkup, just to make sure everything is going well. Because children have a normal schedule for vaccines, and so that needs to be adhered to. But otherwise, a healthy child would have separate appointments with the doctor, and those can be on an annual basis or once every 2 years. For adult women, if an adult woman is sexually active, and by that I mean they're having sex and are over the age of 21, so starting at the age of 21, you can go to the doctor and should have what's called a pap test. It's a small examination of the vagina. It only takes 5 minutes. It's pretty straightforward. The reason is to catch any cancer cells in the cervix. Right there is the cervix. it's cervical cancer. So again, every 2, 3 years, you want to get that checked to make sure that there are no cancerous cells from the age of 21 to about 65. After 65, we don't really check it anymore. Again, with adult women, those over 50 should be going for a mammogram to make sure that there's no cancerous cells there, no breast cancer. And that would be every 2 years. This is what the machine looks like, a mammogram machine. It's that machine is called a mammogram is what it produces. It just compresses the breast, and it's important for a picture, that is, compresses it. And so it's important to have that done until about the age of 70, after which you don't really need it anymore. If we turn to adult men, those over the age of 65, oh, okay. Thank you, Chris and Roy. Thank you. So those over the age of I still will interpret though. Those over the age of 65 have to have an abdominal ultrasound. There's your aorta that goes up through the middle of the body. And what we'll do is an ultrasound. That's the ultrasound machine there. And you just want to have a picture of your aorta to make sure that there isn't an aneurysm, no breaks in it. Anyone really over the age of 40, every 3 to 5 years, should have a blood test, a gathering of blood like this illustration, to see that you don't have diabetes, or as well to check your cholesterol levels to make sure they're not high. So that should be every, 3 to 5 years. And if you have health problems, it might be every year or even every 3 months, depending on your individual health situation. But if you have no health problems, then it's recommended every 3 to 5 years. Again, for any adults, those over 50 can have a test. It's called a stool test. And that's checking every 2 years, that's done. Again, it's for cancerous cells that are coming through the colon or anywhere in the intestines. It's a very simple test. What you do is you pass some stool, you just capture it in this little paper thing, it gets sent off to a lab. Or the other thing that could be used to check is a colonoscopy, where a camera is inserted in the colon and there can be a visual inspection. That might be done maybe once every 10 years or maybe even 5 years, depending on your individual condition. But you want to make sure that there's no cancer there, no colon cancer. So that's starting at the age of 50. There's a little bit more. I'm almost finished. Then when you're over 65, as long as you don't have any other health problems, you'll want your bones checked for their bone health to see if they're weak or you're developing what's called osteoporosis. It means that the bones are becoming weak. For example, if you were to fall, you could break a bone. So it is important that you have that bone condition checked. I mean, the condition of the bones checked regularly every 5 years for those who are over the age of 65. And if you're over 55 and are currently a smoker or have been a smoker in the past, you could have a CT It's in the CT scanner. There's the machine there. You would lie down and you'd be put into it, and they'll take an image of your lungs. They're looking for lung cancer, and that's done on an annual basis for 3 years. So there you have it. That's the formal part of my presentation. I know that was a lot of information, but to be honest, it's valuable information. Some of you might be afraid of going to the doctor, but I'm friendly. Don't be afraid. Come see me. I've got all the patience in the world. If you have any questions, you can make an appointment to see me. You're more than welcome. Oh, good. We're perfect for time. It's 7:17 now. So let's take a break for 10 minutes. And then after which we can come back. And if you have any questions, let me just check with Martin if that, or, oh, here